I first of all want to thank the NHS for the GPs, all the staff, the volunteers here at centres like these up and down the country. They've been working so hard. If you think about what they've done in the last year or so, hundreds of millions of vaccines have been distributed. Over 100 million vaccines have been distributed, and the effort has been incredible. And I know that people will be thinking, have we got to make another great surge like we did earlier this year? And I'm afraid the answer to that is yes. And I just want to say that we'll throw everything at it. And I hope that we can do the same thing again, because everybody can see the situation. We've made a huge amount of progress against the Delta version of the virus, of coronavirus. We now have this question about the Omicron variant that has been located in some parts of the world and now in the UK as well. And while there's doubt about what exactly that variant can do, what we do know is that the boosters can give you a lot of protection against all types of the virus. And we think that's overwhelmingly likely at any rate. So the crucial thing is for everybody now to come out and get your boosters. And that's what the JCVI are now saying. And we've no doubt at all that the NHS, all the volunteers, the army, everybody can rise to the challenge. Is it going to be hard work? Yes, it is, but I know that people can do it.
Now, people are understandably worried whether or not they should modify their behaviour. I just want you to talk a little bit about what people should and shouldn't do in the next few weeks.
Yes.
For instance, should parents not expect to see nativity plays face-to-face? Could schools close early? Should people just pause booking that foreign Christmas holiday?
Okay, Sam, well, look, just on all that, we're not changing the guidance on how you should basically be living your life, except in a couple of ways, and that's to do with putting a mask on in some contexts, such as retail and public transport, to stop transmission, and also making sure that we check people when they arrive into the country, because what we're trying to deal with here is the potential threat from Omicron, and what we need to do is delay the seeding of Omicron in this country. That's why tough checks at the borders are so important. But we don't see any need at present, certainly, to change the overall guidance about how people should be living their lives. And provide people continue to be cautious and sensible, we think that's the right approach. Because if you look at what's happening with the overall state of the pandemic, the Delta, our strategy for fighting the Delta version, the one that's been most dominant for a while now, has basically been working. And there's no doubt at all that though cases are high, the numbers of people being admitted to hospital, numbers of people being admitted to ICU, and sadly a number of people dying, those numbers have all been coming down. So it continues to go in the right direction. What we need to do is to take special measures now to protect against the arrival of Omicron, to delay until we've established exactly what we're dealing with. And so we need the scientists at Porton Down, we need the scientists in the vaccine companies to work out exactly to what extent this new variant, Omicron, may escape the vaccines. And that means, and there are ways in which it can escape. It can either be more transmissible, or else, of course, it can cause more serious illness and death. And I just want to stress, whatever the risks, the answer is everywhere and always to get the booster, because we think that it's overwhelmingly likely that the booster, getting vaccinated will give you more protection.
If that's the case and only small changes are being requested by you, why do you think Jenny Harris, your advisor, said this morning that people should think about, in her words, not socialising when you don't particularly need to over the winter months? Why do you disagree with her?
I think it's always sensible to be careful, and I think what Jenny is saying there is right. We've been living with a pandemic for a long time. People should continue to do things like make sure they have lots of fresh air, they wash their hands and take normal precautions. I think that's entirely reasonable. But we're not going to change the overall guidance. We don't think that's necessary. We don't see anything to suggest that we need to go, for instance, to Plan B. But what we do need to do is take particular precautions against Omicron until we've worked out exactly what kind of a threat it may present. But whatever kind of a threat it may present, Sam, the crucial thing to do is for everybody to go out and get vaccinated. And yes, it's going to be a big campaign, and it will absorb a huge amount of effort, but I've no doubt that the NHS, the volunteers and everybody else can do it.
The boss of Moderna said today that his vaccine would be much less effective because of the new variant, and it would be months before we get a new one. Do you think that's right? I think
what Stéphane Bancel was saying is probably right, but you need to look at what he's not necessarily saying that this will mean that the vaccines are ineffective against serious illness or death, and they may be less effective in preventing transmission. We see some evidence from South Africa that it's the virus Omicron is transmitted between people who have been vaccinated, but it's not clear to what extent this means that you're going to pick up a severe case of Omicron, or that will have a problem with serious illness and death.
Final question, Prime Minister. You're telling the nation to get its boosters. As far as I can tell, you're eligible. Why haven't you had it?
I am, and I've been waiting, but I'm proud to say that I'll be going along later this week, and I'm sure it will be duly recorded by the media. I've been waiting faithfully for my time to come due. But as you know, JCVI have accelerated the timetable for everybody and reduced the delay from your second jab to your booster now to 3 months, which is great.